Hello friends, this is from Pathology and today we are going to take a new series on hemodynamic disorders. Okay, the very interesting topic which you have enjoyed since physiology is also something like that. Beginning with some hemodynamic disorders, the first disorder which comes into your mind is the edema. So I hope you know the physiology behind some pressures. But to give an overview of the same thing, basically see, if I talk about the hemodynamic disorders will be those disorders which will be in one way or the other affecting the dynamics, the flow, the way a blood is flowing, and it can be due to a hell lot of reasons. It can be due to any problem with with the blood itself, or it can be any problem with the blood vessel, or it can be any problems with the viscosity, problems with the pH of the blood, sepsis can be the reason for any hemodynamic disorders. And you already know the hemodynamic. If you know about the blood flow, if we write something about the blood flow, so blood flow is something which is a streamline flow. We also call it laminar flow. So the concept of streamline flow is that you have a blood vessel, and in that blood vessel you have all the blood, the layers, because fluids, they flow in layers. I hope you know fluid flows in layers. So every layer is in the same, the direction of the velocity is common. Okay, but since the blood is made up of blood cells and plasma, the cells will be more towards the periphery. So cells will be around this region and central will be like a bullet. So it will be like this. Central will be the fluid. No, the column of the this fluid which is flowing, and sides of the vessels, the more there will be some cells. But these cells don't rupture. These cells don't, because you already have the plasma adequate levels, plasma volume. Okay, so it will happen only in those dehydrated states or in those hypovolemic states that I will teach you also. To start with the hemodynamic disorders, before first I should give you an idea of all those pressures which you have read, but I will give here a pathological, something concise way. You know that every flow in the blood vessel is based on, if you want to flow, if you want to make the blood flow through a capillary, or you want it to pass through a capillary. For example, this is my blood vessel and here I have tissues. So if you want your blood to pass through, there should be some pressures governing it, because the main thing, those hydrostatic pressures we will be discussing, those pressures. So there comes the significance of that Starling forces. So you have that Starling forces. So it's the Starling forces which will be determining your fluid exchange through the capillary membranes. Okay, how will you understand? So this is the pressure which is governing the flow through this. Okay, so Starling forces. What is the concept of Starling forces? Starling forces, we have, it says that we have some four forces. He says we have some four forces. We have a pressure which is present in the capillary itself, known as capillary hydrostatic pressure. He says we have another pressure which is in the interstitium. I will be showing it, don't worry, just listen first. That is called the interstitial hydrostatic pressure. We have a pressure which is because of the proteins present in the plasma membrane. If the proteins are present in the plasma, not membrane, plasma, so that protein has a pressure, pulling pressure, that is called plasma oncotic pressure. Then he says we have a pressure due to the proteins in the interstitium producing a pull known as interstitial fluid oncotic pressure. Have we listened, understood it? Now we'll write it. So see, he says we have PC. What is PC? Personal computer. Personal computer, isn't it? Personal computer. Isn't it personal computer? It's not personal computer. Basically, it's plasma capillary hydrostatic pressure. So the pressure in the capillary. So capillary. I hope you know the hydrostatic word, isn't it? Like I gave you the example in the hemodynamics, in the physiology. You can refer to that lecture. I will be putting a card here. Okay, you can click on it and then reach to my another channel, that is chambers. So capillary hydrostatic pressure is because of the fluid present in our pipe. We have a pipe, blood vessel. We take it as a pipe, and in that we have blood. So that is behaving. That blood has some pressure. So that pressure will be called capillary hydrostatic pressure. And if that blood is in capillary, we naturally will call it capillary hydrostatic pressure. Now you tell me, if I have this blood, more blood is here due to any cause. We have something more here that is increasing the pressure in the capillary. That means that will be pushing the walls also. That will be pushing some walls also. And will that pressure make this water, this plasma, this content, watery content of the blood come into outside, out of the capillaries? Yes, that has the potential to take this fluid out of the capillary, isn't it? Isn't it, guys? You should regularly reply me, because this is important. And around this blood vessel, we have cells. Okay. So we have cells, and this is the interstitial space which you are talking about. So let me make it interstitial space. Is this, isn't it interstitial space? Yeah, this is your interstitial space. So this is your interstitial space. Yeah, this is your interstitial space. So we are talking about this interstitial space, which is in which the fluid, due to the high, if capillary hydrostatic pressure is high, it will try to push the fluid out of the capillary. So it will try to push the fluid out of the capillary. So try to reach the interstitium. So this pressure will be called capillary hydrostatic pressure. Now here the fluid will reach. This fluid will also try to do some pushing pressure on the capillary. Here also there will be some fluid which is doing that reverse also, which is trying to push fluid into the capillary. This pressure is called as interstitial, because it is in the interstitium, and due to the fluid there, it is increasing. It will also try to do that pressure by virtue of which it tries to push the fluid into the capillary. This pressure which is present in the interstitium and tries to push the fluid into the capillary will be known as interstitial hydrostatic pressure. So we mark it as PI. This was PC. Are we clear? Are we clear, guys? Now, if I have, you know, you know, we have proteins. We have proteins in this blood vessel, with the plasma. This proteins, protein is having some charged species, and it tries to pull the water towards it. That is the tendency. I hope you know this. Wherever you have plasma, because it will increase that osmolarity, and that osmolarity. So if you increase osmolarity of something, that means you're pulling water towards you, isn't it? So that pressure, that osmotic pressure which is produced because of the plasma proteins will be known as plasma oncotic pressure. Okay, so we have this oncotic pressure which is due to the proteins in the blood vessel, and the pressure by them, that osmotic pressure, will be called plasma oncotic. So I should not write like big things, because we don't have to enjoy writing. We have to enjoy understanding the things. Okay, try to understand. Okay, so this is, they don't write it with P, by the way. I'm sorry. They write it with pi. Pi C. Pi C. Okay. And then there will be also some proteins, guys. proteins here in the interstitium. There will be also some proteins in the interstitium, and they will also produce some oncotic pressure. So should not I call them interstitial fluid oncotic pressure? Give me yes or no. See, it's so easy. So we will call it pi, what to call it? Pi I, because it's in the interstitium. It is in the interstitium. So you will tell me now the functions. I will mark them. What is the function of pi if I increase the pi? So you should say it pushes the fluid out of pushes the fluid into the capillary. It pushes the fluid into the capillary. Into. So it is trying to push here. So into the capillary. And if I say I have uh, I have an increased PC. If I say I have an increased PC, what you will say? Sir, the capillary hydrostatic pressure is high. That means it will push the fluid out of the capillary. The word is out of the capillary. So out, let me throw it out from the capillary. So this is out. So it will be definitely something happening in the plasma. So this is the out. This is the pushing the fluid out of the capillary. Out of the capillary. Okay. Next we have pi c. So what is the function of pi c? Pi c is the plasma oncotic pressure. That means what should it do? It should pull the fluid, because think that the protein is something which loves water. So if I increase proteins in some place, if I increase the proteins in capillary, what you should think? Is the plasma volume going to expand in the capillary, or the plasma is, or the interstitial fluid is going to increase? If I increase the plasma oncotic pressure, if I increase pi c, now you remember c is capillary, and capillary we say plasma. So yes, we know that the fluid will be pulled towards it, and in the capillary you will be increasing the fluid. So that means if I increase pi c, I will increase the fluid in capillary. Very nice, because you know wherever I increase protein, I will get more water. Same way, if I say I have increased the interstitial oncotic pressure, what you should think? Is it increasing the interstitial fluid or decreasing the interstitial fluid? Will the interstitial fluid increase or decrease? Interstitial, you have to first understand. Very nice. So it will increase. So interstitial fluid will increase. Are we able to understand the things? So then what he said is, he said what will be the net flow? What will be the net flow? So he gave us JV. He gave us JV. JV, he said it is equal to KF PC minus PI minus sigma of pi C minus pi I. Are we able to understand? So he gave this. What is KF, by the way? What is first JV? JV is the net fluid flow. JV is the net fluid flow. And KF is permeability to fluid, capillary permeability to fluid. Capillary permeability to fluid. Are we able to understand? What is sigma? Sigma says it is called basically as reflection coefficient. Reflection coefficient. What is reflection coefficient? No, that measure of permeability to protein. So he has included two quantities. KF means permeability to fluid, but sigma means permeability to protein. So capillary permeability to protein. I don't think you are able to understand. I think you are sleeping with me, isn't it? You are sleeping, isn't it? Isn't it, guys? You should sleep, isn't it? And I should drink some water also, isn't it? To make my pitches more high, because I get enthusiastic and dynamic while studying. That's why the name came to this channel as Dying Paths. The meaning of my channel, what people are asking, is basically about dynamic pathology. It was Dying Paths. And you are today learning again the hemodynamics. So this is my how I think about the channel name and then put it Dying Paths. So this is reflection coefficient, the capillary permeability to protein. But if I say you how to represent permeability to fluid, who permeability? Capillary permeability, because you are more concerned about capillary. That is the barrier where you will be reaching north and south. No, this is the capillary barrier. So this will actually determine whether the fluid will pass here or here. So this factor should be also taken into consideration. Why? Consideration while taking these pressure changes. Okay. Now guys, you please tell me, giving this overview of, I hope you have understood first I have to confirm. I hope you have understood this. Now you can understand a disease. Now you can understand a disease. See guys, uh, if I say I have a vessel, you will answer me, I have a vessel and I increase the proteins, I increase the collide, I increase more amount of proteins. Okay, where should the fluid move? A region or B region? Because A is the interstitium and this is the capillary plasma. Fluid will reach where? No, how is it possible? A. It will reach B because I taught you in the plasma you have increased the proteins. So proteins will drag the fluid towards themselves and they will pull it. If the proteins are so much, if the proteins are so much that they overcome the hydrostatic pressures, because you have hydrostatic pressures also, isn't it? So you should be so much powerful that you are able to overcome the hydrostatic pressures. This case, that's why I'm telling this case. That means, see again I will say, if the hydrostatic pressure would have been high, that means it is dominating, it is greater than the interstitial fluid pressure, the greater than the osmotic pressure. So that will not let the osmotic pressure to work, oncotic pressure in the plasma to drag the fluid towards it in the plasma. So that's why I made this diagram for you. One is a cell here in the interstitium region and this was the blood vessel. How we will understand. So the movement of the fluid is depending on these pressures. Okay. Now what if I say that a person has you know equality between hydrostatic pressure and osmotic pressure? If I say a person has osmotic pressure pi is equal to both the pi's, so pi's are becoming equal to p's, what do you think? What will the fluid movement be? Yes guys, what should be the fluid movement? It takes you so time to write. I think you are writing some love letter, isn't it? Wow, you are writing so long. I think love letter definitely you are writing. Yes, there is no net moment. No net moment will happen. Okay. So because there is no gain or no net loss happening to the capillary bed, there is no net. They are becoming very nice. They're coming at an equilibrium state because whatever pressure this is exerting the same pressure. They are actually exchanging actually. You are getting a static appearance in your mind, but yeah, internally they will be doing something, I think, isn't it? They will be internally doing something, exchanging something. So uh, but net result, when one goes in one direction, another goes in another direction, you tell that net effect is zero, but we can't say mathematically here zero. We are saying that there is no net moment, no net moment. So something is by the way happening. So suddenly if any pressure gets high, it will drag it here. If here the pressure gets high on cortic, it will drag here. If hydrostatic pressure gets high here, hydrostatic pressure, it will push it here. If hydrostatic pressure in the interstitium gets high, it will push into the capillary. That we have understood in the hemodynamics part in the chambers I have taught in that channel. You should refer to that channel, hemodynamics. I have extensively detailed overview I have given. Okay. Um Very nice. Now let me take you to edema, the concept of edema. Edema. Always speak edema, 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 but yeah, edema should be understood. What edema is, what edema takes. But we don't need to explain it more because we have understood the basic principle. Where is that? I think edema happened somewhere. Yeah, he's not able, I'm not able to catch them. Yeah, here it is. So edema. See guys, edema. To be simple and to understand it, whenever you see excessive interstitial fluid, listen to my word, wherever you see excessive interstitial fluid, tag it there as edema. Excessive interstitial fluid. Excessive interstitial fluid is called edema. This is the first thing. Now, if you want me to speak it in English, I will say edema means presence of increased fluid in the interstitial space of the ECF. Can I say of the ECF? Yes, of the ECF. Because you know, it is in the extracellular fluid compartment. I think you remember the compartments ICF, ECF, interstitium, plasma, taught already to you. Can refer to those lectures in physiology because we are here concerned about pathology. Relevant physiology I am covering. Okay. Um, Now, why this is happening? Why this is happening, by the way? So see, the reason is that um, what actually is happening is the pressures are becoming disturbed. The pressures are becoming disturbed. So let us give you a simple overview. We don't need to make it like a big lecture. It's as simple as that. This is again, I'm drawing a blood vessel and this is supplying in the interstitium. It is supplying we have tissues around it. We have tissues around it. So I have tissues. So I have tissues around this blood vessel. Yes, cells. Yes, cells make tissues. You know this. Now we have interstitium, isn't it? We have interstitium. This is interstitium, isn't it? I should paint this all as interstitium. This is also interstitium, guys, isn't it? Guys, isn't it interstitium or it is something that we're building a house, isn't it? So this is interstitium. Okay. Without understanding, you can't clear any postgraduate exam. Believe me. It all depends on the understanding, not how you are making something or something. Understand the way it is. Okay. Then you can, definitely with your concepts, write the answers, just only, you have to memorize the values or something. Rest all medicine is common sense and understanding. Okay. Now listen to me, have full focus. What if I decrease the plasma hydrostatic pressure, this capillary hydrostatic pressure? If I decrease the hydrostatic pressure, that means I am decreasing something that I'm not able to, no, I'm in less pressure. My blood is in less pressure. Okay. What do you think will happen? Isn't it that there will be that migration of fluid from the interstitium to this equal, they have equal fluid, equal proteins. But I'm telling you, if my hydrostatic pressure gets high in this region, isn't it that the fluid will start migrating from this region because no pressure is doing to prevent that fluid to come into the vessel? It was only because of the high sorry, I'm talking about high hydrostatic pressure. I'm sorry. So if there is high, I'm sorry, please correct this. I'm sorry about this. If my hydrostatic pressure of the vessel is high, that means the fluid will try to move in this direction. That means the fluid will try to move in this direction. If this pressure, please listen to full word I'm speaking. If the full hydrostatic pressure of this capillary membrane is greater than the interstitial hydrostatic pressure, so we have to compare like among the like. When you are comparing interstitial hydrostatic pressure, compare it with capillary hydrostatic pressure, not oncotic pressure. Same way, if you are comparing the capillary oncotic pressure, compare it with the interstitial oncotic pressure, not with the opposite. Are we clear? So I am talking here, if I increase the plasma, whatever you say, capillary hydrostatic pressure more than the interstitial hydrostatic pressure, then definitely the fluid will start leaking into the capillary, from the capillary into the interstitium. You will result in edema. Can I say this will cause edema? Interstitium, more fluid will happen. That's what the definition is. That is what the definition is. Now I say the oncotic pressure is high in the, by another way, thyrotoxicosis is there. I will teach you everything. I have here more amount of um, for example, the oncotic pressure in by any reason gets high. So interstitial oncotic pressure gets high. Proteins, you have more proteins there. Then the greater than the pi C. What do you think? Which will drag? Which will drag? Where will the fluid go? If I am making the interstitial pressure, oncotic pressure, that is due to plasma proteins. Okay, proteins. And here the pressure, here in the capillary, the no, proteins are less. Where do you think the fluid will drag? Region interstitium or in the plasma? Very nice. So this is happening. This is the reason why edema happens. This is the reason why edema happens. Either you are increasing the hydrostatic pressure in the capillary, or you are reducing, can I say I am reducing the plasma oncotic pressure also? Now, can I say as combined, if my hydrostatic pressure of the plasma, please listen to the word, if my capillary hydrostatic pressure is becoming higher than interstitial hydrostatic pressure, and my oncotic pressure of the capillary is becoming higher than oncotic pressure in the interstitium. Can I say these two combinations will cause definitely edema? Definitely together. Can we understand? Who is not able to understand? Please let me know. We will go to the mountains and drink some fresh air and then come back. Who is not able to understand? Sorry. So second we should write PI. Okay, I'm sorry. Mistake. So can we understand? Okay. Thank you very much for letting me know. Okay. Fine. Okay, very nice. You have understood it. So can I say this is why edema happens? Now, this edema, to go into depth of this edema, we have two types of edema. We have some types of edema. Okay. Actually not two. How many I remember? Let me first speak. First is transudate, then is exudate, then is lymphedema, mixed edema. At least four we can write. We can write at least four. So we have transudate. We have this right. So we have types. Can we understand? We have types of this edema. Okay. So it can be just write like this. Types of edema. So these types of edema are, it can be a transudate. It is most important. I don't know how to make you understand that how much important this is. Transudate. Every pathology you will get at least this. Transudate, exudate. What else? Lymphedema, isn't it? Lymphedema and mixed edema. How we will understand? So what is transudate? Listen to me. Trans means it has actually crossed without loosening of the cell junction. So that means the endothelial cells, if I show you this blood vessel, the fluid has crossed. This is the endothelial cells. The fluid, it passed through this transmembranely. It passed through trans. I will understand. So do you think it will have more proteins? Because all proteins will stay here. Do you think the proteins will go more in the interstitium or less? Yes, guys. Isn't am I not producing an ultrafiltrate? Am I not producing an ultrafiltrate? It is showing as a filtration, isn't it? Ultrafiltrate. Am I not decreasing the protein content in this fluid in the transudate? So transudate can be defined as that. If I go to the clinical definition of transudate, transudate says that it's a protein poor fluid. It is a protein. So which fluid we are talking about? This fluid which came here. If you check this fluid, if I take this fluid by the syringe and if I bring it under the biochemical analysis, if I do its biochemical analysis, what I will see, I will understand. See, first transudate happened, and now I drew that fluid. I want to see whether how much protein it has. What is the character? Now transudate passed directly through this vessel. There was nothing that some spaces where there was any inflammation and you had a vasodilation and then you pass the fluid so that the cells can also pass from those loosening of the cell junctions. Diapetesis happened of those WBCs. No, it's under the biochemical analysis. What I see is present in it is very much poor in the proteins, less than 3 gram per deciliter, I think. So it's less than 3 gram per deciliter proteins. Okay, that means, what do you think? What should happen to the specific gravity? What should happen to the specific gravity? So specific gravity becomes less. Specific gravity becomes less. So specific gravity will be less. Okay, so it will become 0. Think something like specific gravity. What to think? You should think about like a solute, something. I won't take you because we came to medicine to evade physics and mathematics, isn't it? We came to medicine because we wanted to evade, isn't it? So we don't want you to take to physics because otherwise you will start abusing me. So in this in this case, I would say just remember the solute is not so much there. That's why specific gravity is decreasing. Think like that. I'm not giving a correct definition. I'm not giving you a perfect specific gravity make you understand. But since we have came into this, so we have to remember that specific gravity will decrease. It would be around less than 1.012. This you have to remember. It will be less than 1.012. So can I say it is a protein poor fluid? Protein poor fluid. Can I say it is a cell-free fluid? Yes, cell-free fluid. Cell-free fluid. Is there any difficulty you have to remember this? No, you don't have to remember anything. You can understand it by yourself. Okay. Can I say this fluid will obey the laws of gravity because it's not having any cell? So it follows the laws of gravity. What is the law of gravity? What is the law of gravity, guys? That means it will settle in dependent parts of the body. If the person stands, he will get ankle edema. If the person is sitting, he's lying down in a supine position, he will get a sacral edema. Now we will understand what is the concept. So it follows the laws of gravity. If a patient is sitting or in supine, will get a as for supine, as for sacral edema. If a patient is standing, now sir, don't tell us sir, here S is also standing. You can understand due to gravity, fluid column will reach here and then ankle edema. Dependent parts will get the edema. Dependent parts will get the edema because the protein is not there. Nothing is pulling, nothing is doing. So they will follow the laws of gravity. Okay, they will follow the laws of gravity, guys. Fine. If I talk about the what else is there? What else we wrote? Exudate. I was about to write exedema. Wow. New definition. Exudate. See, exudate, first to be simple. It is whenever you come across exudate, think inflammation. Whenever you think about exudate, inflammation. So it's an inflammatory rich fluid. Okay, inflammation. That means, sir, it's so easy to now think. That means there should have been some vasodilation. First, there will be a primary vasoconstriction, which I will be teaching you, transient vasoconstriction, by the way. And then there will be a vasodilation, which I will be teaching you in inflammation. I hope you know that at least from the first year. That means some cells will also migrate to that region where infection has happened, because you are arriving the first squad, the first police of the city, that is neutrophils, that is reaching the spot with no time, that reaches there and takes the cognizance of the matter, what is happening there. Okay. Um, that means this fluid should be rich in proteins, inflammatory proteins. There should be more amount of cell debris. There should be the more amount of specific gravity getting greater than 1.020. Are we clear? So that means there should be permeability issues with the blood vessels, those minor blood vessels. That means permeability has increased. So you should remember the specific gravity will increase. It's highly protein rich. You have high protein and has high cells and has, therefore the specific gravity will become greater than 1.020. Important terms, important values to remember: 1.012, 1.020. And there is an effect with the permeability issue is there. Okay, so the protein, that means if I here wrote less than 3 gram per deciliter, then here I should be writing greater than 3 grams per deciliter. Greater than 3 grams per deciliter will be here and will be mostly a neutrophil rich fluid happening. So will you increase the viscosity at this in this fluid? Yes, because you are increasing more amounts of proteins and cells as compared to the fluid content. Will this person show pitting edema? Sir, no pitting edema. Sir, there is so much amount of viscosity. They can't move. There is more amount of protein. So they won't show pitting edema. What is pitting edema? That photos I will show you in the next lecture. So they won't show pitting edema. They won't show pitting edema. They don't pit after some duration of time. We put the finger, pressurize those points, mostly done on your pre-tibial regions. So we put those fingers and then we apply some pressure, and we wait whether this pit will reappear, disappear, or remain the same. So if it remains there for a long time, then will be a pitting edema. If there is the reconstitution of that structure coming back to its initial position, you will say it's non-pitting edema. So will this be a pitting edema? No, there is no pitting edema in this, because you have uh, more viscosity. Okay, so if you have more viscosity, more protein, more neutrophils, no pitting edema seen in exudate. No pitting edema seen in exudate. Let me take you to the lymphedema. So lymphedema is basically again a sort of an exudate, the protein rich fluid which is present in your body cavities and in the interstitium. Okay, so understand, lymphedema is basically protein rich lymphatic fluid. Protein rich lymphatic fluid. Now you people, what do? You get this this concept, you misunderstand this concept. You think that lymph is lymph, lymph is lymph. I'm talking protein rich lymph. I'm not talking about more lymph. You always take that more lymph into consideration while discussing. I'm talking about protein rich lymphatic fluid is there in the interstitium. Please listen to this full word, protein rich lymphatic fluid. You should read like this in the books with open eyes, and word to word you should understand what it is. Then you will get the meaning. So protein rich lymphatic fluid, which is present in the interstitial tissue. Interstitial tissue. Or your body cavities. You have that peritoneal cavity, pleural cavities, pericardial cavity. I hope you are sleeping, isn't it? You are enjoying snacks. No problem. So mixed edema. Mixed edema. Okay. Anyone having birthday today? Birthday? Anyone having birthday by the? Yeah, we have some birthday, I think. Any birthday, you should now start speaking about your relatives also, isn't it? Your grandfather, great grandfather. No. So okay, happy birthday to you. Okay, very nice. God bless you and prevent you for it from edema. So this is mixed edema. Now mixed edema means if a fluid. So can you tell me if it is protein rich fluid, will it cause pitting edema? No pitting edema. Again, it is preventing the pitting edema. Protein rich. Okay. Now what is mixed edema? Mixed edema means if a fluid, please listen to the word again. If a fluid consists more amount of hyaluronic acid, I hope you have read in the my biochemistry lectures in the beginning when some people had left. I had taught you in detail glucose aminoglycans. I had taught you the classification, how to remember them, what is the diseases part which you will be getting in the exams. I think that that has not been recorded unfortunately because in those days we were not recording. So you can refer to my notes which are available with the students. So I have very concisely, easily tried to explain that. So mixed edema is basically if a fluid is containing more amount of hyaluronic acid, that is that's basically a glycose aminoglycan. GAGs we call them GAGs. Okay, GAGs. So one of the GAG is hyaluronic acid. So if this hyaluronic acid is more in a fluid, will increase the viscosity of that mixed edematous fluid, will again prevent the pitting edema. Can you now understand how you can disclose if a doctor tells you the patient was having hyaluronic acid more deposition? So he will say, can I see pitting or non-pitting? He will say non-pitting edema. If we see lymphedema, that's not good. Exudate, fluid is there, said neutrophils are there, protein content is more, viscosity has increased. You will say it's not a pitting edema. Are we clear? But what happened? What happened in the transudate? Since the protein was not there, effusions were happening, cells were not there, so you were having ankle and sacral edema. Okay, and remember, if they ask you what is the reason for transudate, what you will say? If inflammation is not the reason, if lymphatic block is not the reason, if hyaluronic acid more is not the reason, what is the reason for transudate? Transudate should be understood directly. The answer should be the Starling forces. To directly say there is something problem with the Starling forces. Either the plasma oncotic pressure has increased or the plasma hydrostatic pressure has increased. Something has happened. Are we clear? So this is the way you will be clinically attaching things. This is what the clinically you do in a medicine when we are dealing with hyrotoxicosis, when we are dealing with nephrotic syndrome. The patient is having glomerulonephritis, nephritic syndrome, focal segmental glomerulonephritis, focal segmental glomerulosclerosis. These all diseases of the kidney, these glomerulus will manifest with some features in the patient. And the basis for those features is basically the hemodynamics part of pathology. So it's very much incumbent on you people to understand the pathology. Then only you can understand the medicine, because physio, patho, mainly and pharmacology, these are the basics, very much basics, fundamentals of understanding medicine. If these fundamentals you are lagging behind, then it will create problems for your understanding. Okay, so I hope you've enjoyed today's lecture. I will be discussing the next, we will be continuing this, making you understand more things, and I will be taking some tests, some clinical tests, how you can interpret a clinical test, some metabolic disorders also, how to interpret them, some ICU, intensive care unit disorders. So those all things I will be discussing. Okay, so thank you very much. Keep learning, keep enjoying my lectures, subscribe to the channel. Don't forget to subscribe, by the way, because in that way I can understand that yeah, you are interested in these lectures, these videos, so that I can make more videos like this. Okay, so see you all in the next topic. Take care and bye bye.